With the old model, we found that the cost of healthcare was rising exponentially. It was just unsustainable.
Before integrated care, once the patient left the four walls of the hospital, it wasn't really always certain what care they were receiving.
Even with our best efforts, I think the care was still somewhat disjointed, and the patients were unfortunately the ones caught in the middle.
The new care management model is really moving us to where we need to be as far as coordinating services for our patients.
It's an integrated model, and so it's a transition from one setting to the next to make sure that there's no gaps in the care, and then that improves the overall outcomes for the member.
You want everyone involved in the care of a patient thinking about the patient first, and that's what highly integrated coordinated care now provides.
Things are less likely to get dropped. Costs stay down, patient satisfaction goes up, the overall system benefits.
When you use a team approach, the case manager works with that member but also has the resources of the pharmacy to help with any medication education, reconciliation. You have the nutritionist, you have the diabetic educator.
These resources are just available at their fingertips without them having to reach out and try to find it on their own. It's all readily available and accessible to them.
The patient needs to meet the doctor and the team halfway. Can't manage this alone without the patient taking the medications, doing the tests we order, and following up as they're advised to do so.
There's also coming together of the team members to actually discuss the care of the patient and make sure that everybody's on the same page and is unified in what this patient needs.
It's about putting people first. And the end result, if you're putting people first and doing the appropriate tests, the appropriate studies, and appropriate consultations, everybody benefits.
We have a collaborative relationship with Aetna in terms of our complex case management.
We stay connected because we share a lot of the same commonalities. We have a lot of the same goals. We want the same outcomes for our patients. They provide some very good reports as well.
I get active reports on patients, on my quality reports, such as keeping their A1C hemoglobins low for diabetes and meeting goal.
If we as the providers can be more proactive in trying to prevent progression of chronic diseases or prevent the onset of illness, there is a significant benefit to the employer because their cost is lower.
If they have a good experience and it's a coordinated effort, then they're going to be even more productive at work and the employer is going to see better outcomes.
The physicians are starting to see that there's an inherent difference in the manner in which their patients are behaving and how their conditions are improving.
The types of results that we've seen lately are very encouraging.
The preliminary results that I received from the care coordination model are making me a believer. Some of my diabetes patients that I never thought would get to goal are hitting their goals. I think the care model of strong, coordinated care, keeping costs low, but doing what's right for the patient is the key to having a sound future of medicine. If we do that, I think our nations can be better.
I definitely believe that integrated care is here to stay, and I do believe that it's going to continue to grow. We've just really gotten started.